Welcome to This Explainer. Being diagnosed with cancer and starting treatment, it really often feels like you've just been pushed onto a ship and told to set sail across this dark, stormy, totally unpredictable ocean. And if you're feeling overwhelmed by all that unknown, I just want to say right up front that it is completely 100% normal. But today, we're going to take that anxiety and transform it into absolute clarity. I want you to think of the latest medical science as your compass, and your medical team, they're your dedicated crew. So let's dive into this voyage guide together and chart a clear course through the complexities of anti-cancer drug treatment. To make this whole journey manageable, we've got a very clear roadmap for today. We're going to cover 4 key areas: treatment goals and reality, facing physical side effects, navigating life and costs, and your medical team advantage. All right, let's jump right into Section 1, treatment goals and reality. Before leaving the dock, you really need to know your destination. So work with your team to figure out if your main goal is a complete cure, shrinking a tumor, or slowing progression down to protect your quality of life. Now, once treatment actually starts, there's this quiet, nagging fear that creeps up on so many people. You might find yourself wondering, wait, if I have absolutely no side effects, does that mean the drug isn't working? It's terrifying, right? Sitting there actually feeling physically fine and suddenly panicking that the medicine is completely useless against the cancer. Well, let's debunk that myth right now. Experiencing 0 side effects absolutely does not mean the drug is failing. Actually, it means your body is efficiently metabolizing and processing the medicine exactly the way it's supposed to. It's a fantastic sign. You do not need to suffer physical pain for the cure to be doing its job. And here's something else that trips people up: the terminology. When we hear standard treatment versus advanced medical care, human nature makes us instinctively think advanced means better. But in the oncology world, standard treatment is literally the gold standard. It's the absolute best, highly reliable therapy that's been proven by massive amounts of global data to be both safe and effective. Advanced or experimental care is still in development. Its safety and superiority aren't actually established yet. So your absolute shortest, safest route to recovery is almost always that proven standard treatment. And please remember, your treatment plan is never just a dead-end street. If a drug eventually stops working, we don't just throw our hands up and quit. The medical world relies on what we call lines of treatment. Think of these as your successive backup strategies. You start with your first-line therapy, which is the highly recommended go-to. But if that loses its punch, or if the side effects just become too much, you immediately pivot to a second line, then a third line, and so on. It's a highly comforting series of strategic backup plans. Moving right along to Section 2, facing physical side effects. Facing the changes. It's completely natural to fear the physical changes that come with this voyage, but knowing exactly what to expect is literally half the battle. So, a crucial part of this is understanding how your specific treatment actually works inside your body. Traditional anti-cancer drugs attack fast-dividing cells, which, as we know, can lead to common side effects like hair loss. But the newer medications, like immune checkpoint inhibitors, they work completely differently. They essentially release the brakes on your own immune system so it can go fight the cancer itself. While they have way fewer traditional side effects, they can sometimes cause your now highly active immune system to mistakenly attack healthy organs, like your lungs or liver, and this can happen even months after treatment. This means any slight change in how you feel has to be reported to your doctor immediately. Now, if your specific treatment lowers your white blood cells, which is your body's primary defense system, there are some highly actionable steps you can take at home to protect yourself. Switch over to electric shavers and use super soft toothbrushes just to avoid any accidental cuts. Wear your masks, avoid big crowds. But here is the absolute most important rule to remember. If you hit a fever of 37.5 degrees Celsius or higher, that is an absolute emergency. You call the hospital right then and there, even if it's 2 a.m. You really are in active control of these daily protections. Okay, let's address the elephant in the room. When you think of chemotherapy, you're probably picturing those dramatic scenes from movies or TV. You might be dreading it, wondering, are treatments still causing that day-long, unbearable nausea and permanent hair loss? Well, I am incredibly thrilled to tell you that modern medicine has advanced so much in this area. Preventative medications have become absolutely game-changing. Nausea can often be controlled so well now that you can eat totally normally. And as for the hair loss, first off, not all drugs even cause it. But even if they do, it's just a temporary phase of the journey. Your hair typically begins to regrow about 3 to 6 months post-treatment. Plus, the appearance care available today is amazing and can really help you feel like yourself in the meantime. Let's look at Section 3. Navigating life and costs. Because the reality is, The world doesn't just stop spinning because your treatment begins. You still have a life to live. When we talk about daily life realities, people always ask, can I still work? Absolutely. A lot of treatments don't require long hospital stays anymore, so with a bit of rest and coordination, desk work is totally doable. What about being around your family? Well, for about 48 hours after treatment, it's a good idea to flush the toilet twice and wash soiled clothes separately. But beyond that, hugging, kissing, skin contact, it is completely 100% safe. Now, one massive warning though. Natural supplements or herbal remedies. Always run these by your doctor first. Seemingly healthy stuff, like ginseng for instance, can actually completely cancel out your cancer drugs or cause severe liver damage when mixed. And then, of course, there's the cost. It is a huge source of anxiety for families. But there is a vital figure you need to keep in mind, roughly 80,000 Japanese yen. Thanks to Japan's high-cost medical care benefit system, out-of-pocket expenses are strictly capped based on your income. For an average income, it's capped right around this 80,000 yen mark per month, and it actually drops even further for long-term treatments. So go speak to a hospital social worker right away, get your certificate sorted out, and ease that financial panic instantly. And that brings us to our final section, number 4, your medical team advantage. You might be the captain of this voyage, but you have a highly skilled, dedicated crew right there with you. Look, I know doctors can seem incredibly rushed. You sit out in the waiting room for hours, you finally get called in, and boom, your mind completely goes blank. It happens to everyone. So here is a fantastic practical tip. Write down a maximum of 3 questions in a notebook before you go in. The very second you walk into that consultation room, hand the notebook directly to your doctor. Don't even wait. And remember, the doctor isn't your only resource. The nurses and pharmacists are essentially your first mates, and they are always more than happy to step in and answer your questions. Now, here's a massive emotional barrier for so many patients. We think, is asking for a second opinion rude to my primary doctor? We worry so much about being a burden or offending the exact person who is trying to save our lives. Let me be crystal clear about this. It is absolutely not rude. Getting a second opinion is your fundamental right as a patient. In fact, in the medical community, it's a completely standard, positive step toward building total confidence in your treatment plan. Your primary doctor will not be mad. They'll gladly hand over your medical data and write referrals to make sure you feel totally secure in your path forward. Before we wrap up today, I just want to pause for a second, because sometimes the physical side effects might feel so completely overwhelming that you literally just want to quit. You might sit there thinking you're weak for feeling that way. But please hear me on this. It is a perfectly natural human emotion. Don't blame yourself. Wanting to quit is just your body's alarm bell telling you that the side effects need better management. There are always ways to adjust doses, change schedules, or focus on palliative care to protect your quality of life. You never, ever have to suffer in silence. And that brings us to the end of this explainer. Cancer treatment truly is a major voyage, one that shakes both the body and the mind. But you are never sailing alone. So ask yourself, as you navigate this voyage, how are you going to use your compass of modern medicine and your dedicated medical crew to chart the absolute best course for your life? Don't hesitate to lean on your team, adjust your sails when the weather gets rough, and take active control of your journey. Thank you so much for joining me for this explainer, and I will see you on the next one.